Summer in India is really tough. Temperatures are rising now around 40 degrees centigrade, and this is causing lot of trouble to people who are working outside. I'm Dr. Pranav, and today we will talk about what things to do if we see someone who is in the help because of heat stroke. So first, let's understand a little bit about the biology of human body. So human body, inside of it, it maintains the temperature of roughly around 37 degrees centigrade. Whether we go to mountains or whether we are in desert, body works overtime to ensure that the temperature is just at 37 degree. We have mechanisms to cool the body off, like we start sweating, there is evaporation and it cools the body when we are faced with low temperature outside. So we have mechanisms to enhance the body temperature, like we start shivering, shaking, and body gradually raises the temperature to our normal, that is 37 degree. Now, what happens if someone is, say, working in broad sunlight in summers, doing extensive physical work, and somehow he has not got the access of drinking water, or someone is running, like it is very common injury in athletics also, the people who are practicing for long distance running, all of a sudden they fall sick and they collapse. Onlookers don't really know what it is. Is it because of some heart attack or some brain stroke, or it is heat stroke? So the first thing, if you touch the body of victim, the body appears really hot to touch. Temperature is 40 degree. So our body temperature is 37 degrees. So anything that is above our body temperature, if we touch, we feel a sense of hot. So if there is a victim of heat stroke, if you touch the body, he will appear to be very hot. So then you need to do several things. I will discuss one by one. The most important thing is somehow mechanically try to make him exposed to something cold. Make him drink water. If it is ORS kind of water, that is water which is isotonic to the human body fluid, it is much better, because many times it starts with dehydration. Thereafter, you take the victim to some colder place, at least in shadow, some tree shade. If at all it is possible, we are around some home, or we are around office, or we are around some premises where air conditioner is available, so we can make them come inside air conditioner so that it further cools down the body. If it is possible, patient is conscious, you can make him take a cold shower, that definitely helps. You can also sponge the patient, especially the exposed area, with ice. Ice can also reduce the body temperature very quickly. So the idea is to reduce the temperature of body and replenish the fluid. There is a science behind fluid loss. All we know from our study of biology, that human body is made up of billions of different cells, and every cell is like a balloon. It has some fluid inside and lot of chemistry is taking place. But for the health of balloon, the integrity of the balloon is very important, the membrane that holds the fluid. When temperature is very high, the protein in the membrane of cell balloon starts denaturing, and then fluid starts leaking. When the fluid is leaking, the most important thing that happens is there is a problem of dehydration. So mark very carefully that whenever you are trying to take care of patients who have suffered heat stroke, make them drink some fruit juice, some cold fruit juice preferably, or ORS liquid if it is available at your premises, and then try and reduce temperature as quickly as possible. So to reduce the temperature, as we discussed, we can request the patient and we can facilitate a cold shower. We can sponge bath the patient with ice. We can place the patient in an air conditioned room and reduce the temperature of air conditioner, preferably take it down to 16 degrees centigrade. If with this measure things are not improving, you must know you should take the patient immediately, because if, and mark my words very carefully, if the temperature of body remains at 40 degree for more than 30 minutes, it can cause irreversible damage. It can cause even deaths. United States, last year the data from CDC suggests that 600 people died because of heat stroke. And in India, the number is no less. And so are the cases in Africa also. So we need to spread awareness about heat stroke and some common measures while we are traveling outside in sunlight. Keep water with you, keep some sachets of ORS, wear light clothes, wear clothes which breathe, so allow the sweating to take place easily. Preferably use natural cloth, that is cotton cloth, cotton or linen can also be useful, but please do not wear synthetic cloth where the breathing ability of body starts getting less and less. As we discussed, wear loose fitting clothes. Too tight clothes again won't allow sweating to easily take place, and evaporation also it will be obstructing. So loose fitting clothes, cotton clothes, linen clothes, all the natural fabric that's very easily breathable, so that really helps in keeping our bodies cool. That's why you can see all the countries which were in tropical region, including our India. So we had a tradition of loose fitting clothes. Like in India, we used to wear long yards of dhoti, and we always had our a small towel, which was also used for fanning our body. So that way, we had enough arrangement for cooling down, and we had always phrases which said "Rahman pani rakhiye." So they always suggested keep water handy. So in summers, do not travel without having a bottle of water with you. Also ensure you have ORS sachet. If the temperature is very high, please wait before going in broad sunlight, especially the sunlight around 12 to 3 will be really hot, and it can cause lot of damage. Especially the damage is more pronounced and more challenging in the cases of kids, in the cases of old people, because in both cases somehow the temperature rises quickly and patients are not conscious, and in that condition it can become even life threatening. I hope this video could educate you about heat stroke, and in this summer we are well prepared for fighting heat stroke and saving life. If you like the video, please press the like button and share this video with your friends and family so that we all are protected in this beautiful summer. Thank you.